Hello, I'm Dr. Ruth Roberts, and Ollie and I are going to demonstrate a few techniques that are used in Tui Na. Tui Na is a form of body work that was developed in traditional Chinese medicine. We use 3 of these types of moves very commonly for dogs to help loosen up their backs, reduce pain, and improve their mobility. So the first one is very simple. It's called rubbing. And essentially all you're going to do is take your hands and rub them up and down the dog's spine. And in doing so, you're going to improve blood flow into these tissues that have also often become transfixed or stuck. The fascia, if the dog has not been moving very well, the fascia becomes adhered to the muscle underneath it. And so that makes it very uncomfortable for the dog to flex its spine properly. So all we're doing is rubbing our hands back and forth up and down the spine. As you can see, Ollie thinks this is a grand idea and would probably stay here for as long as I could bear to do this. So you want to, again, move up and down the entire spine, remembering that the spine goes down to the base of the tail, and continue working your way up. You're going to feel some heat develop as you're doing this, as the blood begins to flow into this area. The next technique is a rolling technique, and you're going to start at the base of the spine, take a small pinch of skin between your fingers, and then roll that pinch forward up towards the neck. If your dog has some pain or mobility issues, you will notice certain areas where the fascia is adhered down to the muscle, and so it will be difficult to carry that roll forward. Your dog will probably turn around and look at you if it's a little uncomfortable, and what that means is that you need to stop, loosen your hold on that pinch, let it drop a little bit closer to the body, and just work through that area more tenderly. Ideally, you would do this rolling technique 12 times. As you're starting into this, you may only be able to do it 1 or 2 times comfortably for your dog. So let him or her guide you as to where their comfort level is, and eventually you'll be able to get up to that 12 times. The last technique we use is a kind of a palpation technique, and when I'm looking at animals for the first time to determine where different points of discomfort may be, and also scanning the bladder channel to look for points that are uncomfortable, which will help diagnose where the imbalance is within the system. I start up here running my fingers parallel to where the spine is. So the bladder channel is roughly 1 inch, so depending on the size of the dog, 1.5 inches for Ollie, away from the center of the spine. And literally what I'm going to do is push parallel to the spine, looking for any places where you may feel some depressions or where it's tender to the dog. If you find areas that have depressions, then you want to go back and spend a few minutes massaging that area in particular. Again, start with relatively light pressure. If your dog turns around and looks at you, that means that you're pushing in a little bit too roughly, and so back out a bit. Start over, go with lighter pressure, work your way in gently until you've gone as deep as you feel you can for that session. So that's the 3 basic techniques we use frequently in Tui Na. Ollie is already knocked out and very relaxed, so he's ready for his difficult day of lounging on the dog bed. I'm Dr. Ruth Roberts. I hope this has been helpful and will serve you and your pet.